Sleep for your baby and yourself is easily the biggest concern for parents. Sleep deprivation can lead to postpartum depression and marital tension. Babies and toddlers experience sleep regressions, emerging teeth, and growth spurts, all of which usually interfere with your little one's sleep. Sometimes it's easy for parents to go wrong when it comes to certain habits and routines to get baby to sleep. Check this list to make sure you are avoiding these common baby sleep mistakes. 1. Making baby dependent on you to sleep. It's important that babies learn how to soothe themselves. If mom always rocks baby to sleep in her arms, baby will always rely on mom. Then, when your little one wakes up in the night, they'll cry until you or your partner holds them again. That's why the American Academy of Pediatrics recommends putting baby in the crib when they are drowsy but not completely asleep. 2. Going to baby as soon as they stir at night. It's important to respond to baby's cries, but it's not necessary to go to your little one the moment they begin whimpering at night. If baby is making noises and fusing, it's okay to wait and see what happens. Sometimes, baby will learn to comfort themselves and fall back asleep. Rather than immediately going to baby, give your child a few minutes to try to settle back down to sleep after waking up. They may do just fine without your help. 3. Rocking baby to sleep. If you do this frequently, your baby will begin to depend on being in your arms to doze off. If she tends to fall asleep when you give her a bottle or nurse her, gently wake her up before you place her in her crib. 4. Putting her to bed with a bottle. When your baby falls asleep drinking a bottle, formula can pool in her mouth, leading to tooth discoloration and decay. Sleeping with a bottle also increases her risk of ear infections. 5. Confusing days with nights. She'll never be able to sleep through the night if she doesn't learn the difference between dark and light. To help your child organize her natural sleep rhythms, keep her room light in the morning and during daytime naps, and don't leave a light on in her room at night. 6. Extending nighttime feedings. Your child is ready to give up middle of the night feedings once she reaches about 12 pounds. If she is much heavier than that and is still crying for food at 2 o'clock a.m., it's a learned behavior. Instead of whisking her out of bed for a feeding, give your child a chance to put herself back to sleep. 7. Putting baby to sleep on their stomach or side because it's more comfortable. Babies' muscles, especially newborns, are not developed enough yet to allow them to move themselves out of a dangerous situation. If you put your baby to sleep on their side or stomach and their mouth and nose are covered or their breathing is restricted, they may not be strong enough to move so they can breathe. Even if you think your baby might be comfortable in another position, always put your baby to sleep on their back. If your baby is strong enough to roll onto their side or stomach on their own, you can leave them in that position as long as the crib area is clear. 8. Using blankets in the crib to keep baby warm. Blankets and pillows pose a suffocation risk. Blankets can end up covering baby's face and obstructing their airways. To keep your baby warm and cozy, consider using a swaddle or wearable blanket or sleep sack with pajamas underneath. This will keep your baby comfortable without having any loose bedding in the crib. 9. Sharing a bed. Some parents choose to co-sleep with their children in a bed. However, you will be sending mixed messages to your child about where they sleep, and that can result in them having difficulty falling asleep in a crib and without you lying close to them. In addition, bed sharing can actually increase the risk of sudden infant death syndrome and other sleep-related deaths. 10. Blocking out the noise. It is not ideal to try to remove all the noisy distractions. If your baby learns to sleep in complete silence, they might have difficulty falling asleep later when there's no way to block out every possible source of noise. Sometimes, it is even recommended for you to use white noise machines that can help your baby fall asleep easier, but they should be used with caution. 11. Sleeping in the car seat, swing or bouncer. According to the AAP, letting babies sleep in a car seat, swing or bouncer for extended periods of time is a safety hazard because baby's head can fall forward, cutting off their airway. The safest place for your baby to sleep is always a firm, flat sleep surface. Keep car seat naps limited to car rides. If baby conks out in the car, there's no need to panic, but transfer them to a flat sleeping surface as soon as possible. The same goes for bouncers and swings. Following safe sleep guidelines and avoiding these common sleep mistakes will keep your baby sleeping peacefully and give you peace of mind. Thank you for watching. Please remember to like and subscribe to help us keep bringing you this everyday knowledge.